As we age past 50, many changes sneak up on us: slower recall, occasional brain fog, or that frustrating moment when you forget why you walked into a room. While many blame aging itself, few realize that key natural vitamins essential for brain health decline silently, with serious consequences. Welcome to Wellness 60 to 100, where we uncover science-backed insights for living better, longer. The brain doesn't just age, it gets starved. After 50, your body produces or absorbs certain vitamins less efficiently, yet your brain relies on them more than ever. This quiet decline often goes unnoticed until symptoms, like memory lapses, mood changes, or cognitive fatigue, become persistent. I'm Dr. Emily Carter, board-certified geriatrician, and in today's video, I'll walk you through 7 vital natural vitamins that steadily drop after 50 and how this directly impacts your mental clarity and neurological resilience. You'll learn what they are, why they decline, and, most importantly, how to restore balance through diet, supplements, and simple lifestyle changes. Whether you're noticing early signs of mental slowdown or want to be proactive about healthy aging, this video gives you the practical, science-backed tools to support your brain and your future. Among the most critical yet often underestimated nutrients that decline after age 50 is vitamin B12. This water-soluble vitamin is essential for neurological health, energy production, and DNA synthesis. But what truly sets it apart is its role in preserving mental clarity, preventing cognitive decline, and supporting emotional stability. As we age, the body's ability to absorb B12 decreases significantly, largely due to a drop in stomach acid production, an issue that affects up to 30% of older adults. What makes vitamin B12 particularly important for healthy aging is its involvement in maintaining the myelin sheath, the protective layer surrounding nerves in the brain and spinal cord. Without adequate B12, nerve conduction slows, leading to symptoms that often resemble early Alzheimer's, memory lapses, mood swings, difficulty focusing, and confusion. Unfortunately, these early warning signs are frequently dismissed as just getting older. For those over 50, the risk is even higher if they're on long-term use of antacids, metformin, or follow vegetarian or vegan diets. While B12 is found naturally in animal-based foods like beef liver, eggs, fish, milk, and poultry, diminished absorption means diet alone may not be enough. Routine blood tests can reveal deficiencies early, and unlike many chronic issues, B12 deficiency is highly treatable. If your levels are low, supplementation is safe and effective. Doctors often recommend sublingual B12 tablets, nasal sprays, or even monthly injections. These methods bypass the digestive system, ensuring direct absorption into the bloodstream. You don't have to wait until forgetfulness turns into fear. A simple correction in vitamin B12 levels can lead to better focus, restored energy, and sharper memory, all vital components of sustained brain health. In the journey of healthy aging, this one vitamin may quietly make all the difference. While most people associate vitamin D with bone strength, its influence on the brain is just as critical, especially after age 50. As we grow older, our skin becomes less efficient at synthesizing vitamin D from sunlight, and dietary intake often doesn't meet daily needs. This slow and silent deficiency is more than a bone concern, it's a neurological red flag. Vitamin D plays a vital role in neuroprotection, supporting the brain's ability to form new connections, regulate mood, and control inflammation. Low levels are directly linked to increased risks of depression, cognitive decline, and even Alzheimer's disease. Studies have shown that older adults with chronically low vitamin D are more likely to experience memory loss, slowed thinking, and difficulty with concentration. What makes vitamin D crucial for healthy aging is its ability to modulate immune responses within the brain. Inflammation is a key driver of neurodegeneration, and vitamin D helps suppress harmful inflammatory signals that can damage brain tissue over time. In addition, it supports the clearance of amyloid plaques, abnormal protein clusters associated with Alzheimer's. Natural sources of vitamin D include fatty fish like salmon and sardines, fortified milk, and egg yolks. However, many older adults don't consume enough of these foods daily. Sun exposure, another major source, also becomes less reliable due to changes in lifestyle, skin function, or geographic location. That's why deficiency is so common in people over 50, especially in winter months or among those who spend limited time outdoors. The good news is that vitamin D levels are easy to measure with a simple blood test. Supplementation is both safe and effective, often recommended in the form of D3, cholecalciferol, for better absorption. For brain health, many experts suggest maintaining blood levels between 30 to 50 nanograms per milliliter, though this may vary depending on individual health conditions. If you've been feeling foggy, unusually fatigued, or emotionally flat, vitamin D could be a missing piece of the puzzle. Replenishing it doesn't just protect your bones, it helps fortify your mind, uplift your mood, and preserve your independence. For anyone focused on long-term brain vitality and healthy aging, this is one vitamin that simply can't be overlooked. Among the most important nutrients for brain chemistry, vitamin B6 often gets overshadowed. Yet its role in maintaining emotional balance and mental sharpness is profound, especially as we age. After age 50, the body's ability to utilize B6 declines due to changes in metabolism and liver function, even when dietary intake appears sufficient. Vitamin B6 is essential for the production of neurotransmitters, namely serotonin, dopamine, and GABA, which regulate mood, focus, and cognitive processing. A decline in B6 can lead to irritability, forgetfulness, depression, and a general sense of mental fatigue. These symptoms are often dismissed or misattributed to stress or aging, but in reality, a chronic B6 deficiency can erode emotional and neurological resilience. In the context of healthy aging, vitamin B6 plays another critical role, reducing homocysteine levels in the blood. Elevated homocysteine is a known risk factor for cognitive decline, stroke, and dementia. B6, along with B12 and folate, helps metabolize this harmful amino acid, protecting blood vessels in the brain and supporting overall circulation. Good food sources of B6 include poultry, fish, bananas, fortified cereals, spinach, and potatoes. However, absorption and bioavailability become less efficient with age, particularly in those with kidney issues, liver disease, or alcohol use. Certain medications, such as isoniazid, hydralazine, or long-term use of NSAIDs, can also deplete B6 levels in the body. Supplementing B6 can be helpful, but dosage matters. While moderate doses, 2 to 10 milligrams daily, are generally safe and effective for older adults, excessive intake over time can cause nerve damage. That's why it's essential to consult a healthcare provider and test levels before supplementing aggressively. If you're experiencing persistent anxiety, mood swings, or a foggy head, vitamin B6 might be a key player behind the scenes. Addressing this silent decline can lead to noticeable improvements in emotional well-being, sleep quality, and cognitive focus. In the broader picture of healthy aging, vitamin B6 helps you stay mentally steady and emotionally strong, both of which are essential for maintaining independence and a high quality of life as the years go on. It's a small nutrient with a powerful impact, and one that deserves much more attention after 50. Folate, also known as vitamin B9, is a powerhouse nutrient for brain development and cognitive maintenance. While it's widely recognized for its role in prenatal health, its importance doesn't end at birth. In fact, after age 50, folate becomes even more critical for protecting brain function. Unfortunately, folate levels tend to decline with age, partly due to reduced dietary intake and changes in gut absorption. One of folate's key functions in healthy aging is its role in regulating homocysteine, a harmful amino acid linked to cognitive decline, stroke, and even Alzheimer's disease. When folate levels are too low, homocysteine builds up in the blood, damaging blood vessels in the brain and impairing oxygen and nutrient delivery. The result? A gradual loss in memory, focus, and mental flexibility. Folate also supports DNA synthesis and repair, which helps the brain regenerate cells and maintain neural integrity over time. It's essential for neurotransmitter production, especially serotonin and dopamine, which regulate mood and motivation. Low folate levels have been consistently associated with depression, cognitive fog and decreased processing speed. Natural sources of folate include leafy greens, like spinach and kale, legumes, citrus fruits, beets, and asparagus. However, many older adults don't consume enough of these foods daily. Cooking methods, like boiling, can also destroy much of the folate content. Compounding the issue, some seniors have a genetic variation, MTHFR mutation, that reduces the body's ability to convert folate into its active form, making even normal levels functionally insufficient. Supplementation with methylated folate, L5-MTHF, is often recommended for individuals over 50, especially those with absorption or conversion issues. This bioavailable form bypasses metabolic limitations and can more effectively support brain and cardiovascular health. If you've been experiencing slow thinking, mood dips, or forgetfulness, a folate deficiency may be quietly contributing. Testing and correcting it early can significantly enhance mental clarity and emotional stability. Folate is more than a nutrient, it's a neurological safeguard. For anyone focused on healthy aging, keeping vitamin B9 in balance is a smart, proactive step to protect your brain now and in the years ahead. As we pass the age of 50, oxidative stress becomes one of the greatest threats to brain health. This is where vitamin E, a fat-soluble antioxidant, plays a central role. Known primarily for protecting cells from free radical damage, vitamin E is also a powerful ally in preserving cognitive function, especially in older adults. Yet, its levels often decline silently with age, largely due to dietary shifts and poor fat absorption. Vitamin E protects the neuronal membranes, the outer layer of brain cells, by neutralizing free radicals that cause inflammation and degradation. When vitamin E is deficient, brain tissue becomes more vulnerable to oxidative damage, accelerating memory loss and cognitive decline. Numerous studies have shown that low vitamin E levels are linked to an increased risk of Alzheimer's disease, especially in adults over 65. In the context of healthy aging, vitamin E is particularly important for maintaining long-term brain resilience. It not only defends against environmental toxins but also supports communication between nerve cells, helping maintain mental agility and sharp recall. It also works in tandem with other nutrients, such as vitamin C and omega-3s, to stabilize brain chemistry and reduce age-related inflammation. Good sources of vitamin E include nuts, especially almonds and hazelnuts, seeds, spinach, avocado, and plant-based oils like sunflower or wheat germ oil. However, older adults who follow low-fat diets or have gastrointestinal conditions, such as celiac disease or Crohn's disease, may have difficulty absorbing enough vitamin E from food alone. Supplementation may be beneficial, but with caution. Vitamin E exists in multiple forms, alpha-tocopherol being the most active in humans. While it can be helpful in doses between 100 to 200 IU daily, high doses over time, especially above 400 IU, may increase the risk of bleeding, particularly in those on blood thinners. Always consult a physician before starting supplements. If you've noticed increased forgetfulness or slower thinking, low vitamin E levels could be part of the equation. Supporting your brain with this antioxidant isn't just about memory. It's about defending the integrity of your neural system as you age. To support healthy aging, vitamin E acts like a shield, quietly defending your brain from internal damage that builds over time. While often praised for their roles in immunity and blood clotting, vitamin C and vitamin K are quietly essential for protecting brain health, especially in adults over 50. These two nutrients are often overlooked in cognitive health discussions, yet their decline with age can contribute significantly to memory issues, reduced processing speed, and increased vulnerability to neurodegeneration. Vitamin C is a powerful antioxidant, concentrated heavily in the brain, particularly in regions responsible for learning and memory. It plays a critical role in collagen synthesis for blood vessel integrity, supports neurotransmitter production, especially dopamine, and helps reduce oxidative stress in brain cells. As people age, both intake and absorption of vitamin C may decrease, especially among those with poor diets or chronic inflammation. Low levels of vitamin C have been linked to increased risk of depression, fatigue, and mental fog. Meanwhile, vitamin K, best known for its role in blood clotting, has emerging importance in healthy aging, particularly in cognitive function. It's involved in the synthesis of sphingolipids, essential fats that support brain cell structure and signaling. Studies have found that older adults with higher vitamin K levels perform better on memory and learning tests. A deficiency can compromise blood flow to the brain and increase the risk of small vessel damage, which over time contributes to vascular dementia. Natural sources of vitamin C include citrus fruits, bell peppers, strawberries, and broccoli. Vitamin K is found in leafy greens like kale, spinach, and collard greens, as well as fermented foods like natto. However, older adults who avoid acidic foods, due to reflux, have gastrointestinal issues, or take medications like blood thinners may struggle to maintain optimal levels of these vitamins. Supplementing with vitamin C, in moderate doses of 250 to 500 mg/day, and getting enough vitamin K through diet can help maintain cognitive stability. If you're on anticoagulants, always consult your doctor before increasing vitamin K intake. Together, vitamin C and vitamin K form a protective duo, guarding your brain's blood supply, reducing inflammation, and preserving neuron integrity. Their combined effect may not be flashy, but it's foundational. For those invested in long-term healthy aging, paying attention to these subtle deficiencies can mean the difference between cognitive decline and lasting mental vitality. Ignoring the quiet decline of these 7 essential vitamins after age 50 can have serious, long-term consequences. Left unaddressed, deficiencies may lead to chronic memory problems, accelerated cognitive decline, increased risk of dementia, and persistent mood disorders. You might experience brain fog, fatigue, or mental confusion, often mistaken as just aging. But these are warning signs your brain is starving for nutrients. Over time, the damage becomes harder to reverse. For anyone committed to long-term independence and mental sharpness, overlooking these gaps undermines your entire approach to healthy aging. Prevention isn't complicated, but inaction can be costly, both mentally and emotionally. As a geriatrician, I've seen how small nutritional gaps can quietly erode brain health over time. That's why I encourage my patients to be proactive, not reactive. If you're over 50, don't wait for serious symptoms to appear. Get your vitamin levels checked annually, especially B12, D, and folate. Incorporate nutrient-rich foods into your daily meals, but also recognize when supplementation is necessary. Choose high-quality supplements, and always consult your doctor before adding new ones. Most importantly, listen to your body. Fatigue, forgetfulness, or mood swings aren't just part of aging. They're signals. Supporting your brain with the right vitamins is one of the smartest, simplest ways to protect your independence and clarity as you age. That's real healthy aging. If you found today's video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss a new release from Wellness 60 to 100. We're here to help you take control of your health, one smart step at a time. Leave a comment below if you've experienced changes after 50, and share this video with someone who cares about healthy aging just as much as you do.